guys, I wanted to hop on here real quick. Sorry for the lighting, I'm in the garage. Before this video starts, I just wanted to do like a quick little intro on some thoughts I have before I end the video. It's gonna be like a 12-minute video. A little like montage of things. I stop and talk here and there. I can't show a lot of what happens in the hospital because, you know, can't do that. But I wanted to say the one main thing that I want to say is hard for a new grad, especially if you're transitioning. How do I say it? If you never worked in healthcare, it's gonna be hard. But if you worked in healthcare and you went from, like, let's say you were an ED tech, and then you went to the bedside, I think you're gonna have the problem that I'm having. Is everything you learned in nursing school, not everything, but like, you know how you come in and the first thing you do is like, you do CNA work and nursing stuff too when you were a student. But you have to do everything, like the nursing stuff you have to do with your teacher, clinical instructor. So, you know, you already in your mind have that, and you come to work and you think it's almost the same thing. Obviously, you're not gonna do CNA things, but like you want to do your head to toe with all your patients and everything. I have been here for a week and a day, or my whole week. I just did a full week, and I haven't done that one head to toe. I haven't even used my stethoscope because depending who's with me, a lot of after a year or so in as a nurse, you're gonna learn to do things differently. You're not gonna be doing a head to toe like you did in nursing school and stuff. So yeah, hopefully today I'll learn with someone. Like, I just want to see what a nurse does as soon as they get. I want to see how they do their head to toe. Sometimes they do their head to toe way later on after they give meds. They don't do like a thorough thing. Some people do listen to the heart real quick in the lungs, bowel sounds. But you're not gonna be telling your patient, can you smile? Can you squint your eyes? Not like a whole bunch of things. You're not gonna be touching their head a whole lot. Like, you'll know what, especially the floor I'm on, we get some long-term patients that they've been there for such a long time. I've already had a couple patients a couple times already. So unless they on report they tell me the sentence changed, I'm not gonna keep checking things, So yes, I just wanted to say that. Now enjoy the video. Hey guys, here I am at home doing orientation for work. I'm just at home chilling for the first 2 days. And then you get hungry and you gotta eat lunch because you don't want to take a whole half-hour break. You just want to eat, multitask, and listen to this.
Lone gunman opened fire shortly after 12:30 a.m.
I will tell you that documenting blood is on a flow sheet. Okay?
Holy crap, is the time for my first official day at work at the hospital. I've been waiting for this moment for so long. This feels so unreal still. I'm pretty nervous even though I'm gonna have a preceptor and they're not gonna throw me to the sharks, like, right away. But still, it is, 40. So I'm leaving, guys, because I got extension by 2:55-ish. Oh, it's kind of dark in here. Had a good first day of work. I like it. It's really nice. Yeah. Yeah, I got a whole bunch of stuff in my pocket. Alright. Let's go home. So I'm just eating here. Who knows who slept and drooled, and who knows what else happened on this couch, God forbid. Yeah, that's my little table. I don't even know if technically it's a break room where I was gonna go eat, but all the CNAs are there. That's like their little lounge. Yeah, I don't want people staring at me eating. So this is like a little nap room, I guess, for residents, or I don't know. These scrubs get washed anyways. I don't reuse them twice, so. Yeah, nurses get breaks. Maybe it's just because I'm orientating, but take your break when you can, people. There's always a little bit of free time. And then when you're peeing or taking a shit, you can review S-Bar. Okay guys, I don't know how dark it is. Let's talk a little bit about my first week of work. It was good, you guys. I was, like I said, I think in another clip I said I was nervous, and then I said I really enjoyed my day. Oh my god, it's really dark. It's 11:55 right now. I worked till 11:30. I stood till like 11:40 today. The person that was supposed to relieve my preceptor, the float nurse or something, and she wasn't there yet. And she was like, "Just go. You can leave." So today is Saturday night. I work evening shifts. It's good. It's going good. I don't have a set preceptor. I just go with whoever the heck wants to take me. So yeah. It's been going good. Today was a really good day. Like, my preceptor really didn't want to precept me. She's like, but you're gonna have to follow someone. She says she's always, I guess she precepts a lot. She's been on that unit or at that hospital for 34 years. And she's a preceptor, you know? So anyway, she was great. So I only worked, how many days this week? I don't even remember if it was like, yeah, I think it was Tuesday, Wednesday, Thursday. No, Monday, Tuesday, Wednesday. Thursday off. Then Friday, Saturday, Sunday, and then I have Monday off. So it's good. Basically shadowing, but they teach you, like, they try to teach you how to chart and stuff like that. Sometimes I do meds, sometimes I don't do all the meds. Like, I haven't done everything myself, but we just take, opportunities, and we'll do whatever, like. If she wants to let me pull a med out of the Pyxis, great. If they want me to, to give insulin, to do whatever, I'll do it. Admissions, I've done like one, but not like a full-blown one. But it's been going good so far. Next week, Thursday, I think it is. Next week, Thursday, I have to go to the emergency department and do IVs, so I think the next clip will be me talking about that. And I'm sorry that it's really dark, but I just wanted to talk where I could just say whatever. And then the next clip will be like my experience on that, or it might be a whole separate video for all I know. And then that's it. Hey guys, don't mind the scruffiness. I look scruffy. Yeah, so it's getting better and better at work. Today is Wednesday, the day before I go to the ED. Not the last clip, but I think I in the beginning, my intro, I was talking about how I hope that I have a preceptor that's gonna teach me like a head to toe and stuff like that. So what happened that day was, yeah, I ended up having a really good preceptor that let me do much more than anyone else. It's not all about like when you are a new grad. For me, it's not all about the skills. It's not about giving meds and whatever. It's more about, okay, now this is the real crap. Like this is the real shit. Like of how to be a nurse. Okay, so like, how do you prioritize who you're gonna give your meds to first? How are you gonna juggle everything, time management? Because it's not. It's like I said, it's not. Oh, come into work and I go say hi to all my patients and do it head to toe, and then I look at what's on the chart. No, that's not how it works. Like you get a report, you look up their meds. The meds is the most important thing. You look up the meds and whatever orders they have, and then like while you go in there, depending how much other meds you got, like you have this on Epic. We have Epic in our hospital. We have you assign your patients to yourself, and you have this thing called the brain. And every hour you have something to do. So you gotta cluster your care. If you're in there and the patient, let's say the patient has COVID, I try not to even go in their room for anything unless I absolutely have to. So if they have meds at 9 o'clock at night and 10 o'clock, you best believe like at 9:30 or even 9 o'clock, I could give both those meds and do my head to toe, even if it's at nighttime. Fortunately, yeah. You remember the aides? They in my hospital when they press the button, their nurse button, it goes to the aide first, and then if the aide for some reason doesn't pick up her phone, then it'll come to me. But if I'm very busy doing other things like meds, other more important things than taking a person to the bathroom, you best believe that the aide's gonna be doing it. Yes, I try to help my aides. We all try to help our aides as much as we can on our floor. But if I can't help you because I have nursing things to do, that's a lot, like that no one else is gonna help me with. Yeah. Anyway, so yeah, I was able to in my hospital, the three main things you should be charting, documenting is your assessments every day. For each patient, you do. I have only an 8-hour shift, so I only do it once. So that's the assessment that includes like the fall risk and stuff like that. Checking your IVs was very important to chart. And then the second thing is like the care plan. Like I said, are you is the patient doing better and stuff like that. And the third thing is education. So did you educate your patient on anything? You pick a subject, and you say you educated them. And for the care plan, that's where I write my progress note. And that's for like, if there's any goal I have in the 13, I don't even know how many weeks. I think it's 12 weeks. 12 weeks of orientation is can I document correctly? That's like, because like I said, in nursing school you don't get taught how to document. So yeah, that's like my main goal, and my preceptor on Sunday helped me do that, and then on Tuesday, which is yesterday, I finally met my real preceptor. She's gonna precept me the most out of everyone else, but yeah. So she was great. Like she showed. I did blood administration yesterday for the first time. It was good. So I'm getting the hang of it. Getting the hang of everything. And yeah, just like documenting. Sometimes I don't know what to put in my progress note, but like especially if it's not much happened. But I try my best, and she looks over my stuff and she says I was doing really good. I gotta work on my report. Like when I give reports, sometimes I'm just like all over the place, just because I don't. It's like I said, I think I said it already. A lot of our patients are long term, so they've been there for such a long time, and we've had this patient for such a long time. Like, okay, you just go up to the person that's gonna take your shift and say, okay, anything changed with them? No, okay, bye. Literally. So, like if the person didn't get insulin that day, if I held a med, if there's anything new, but that's the great part that you probably see memes all the time when you give report to the person that had the patient already the day before. It kind of goes pretty quickly. But yeah, that's all I wanted to say. In the next, for real, the next clip will be talking about my IVs, like how my experience was. I'm telling you, I'm like so nervous for that. But I know once I get the first one, then I'll probably just get the hang of it. It's just practice. Hey guys. Okay. So I just got off my shift that I did for the ED doing the IV insertions. There was a lot of IVs today. I want to say like 10 to 15 of them. And I did about 5 to 6 out of those. I actually got a vein and did it. There were some other ones that were really, really hard, or the patient denied having a learner or whatever. And sometimes, like, I'll go in and then I can't really get it, and then the person that was teaching me will go a little deeper and then they'll get it. So I actually like, had the vein, I just had to go deeper, but the patient will be like in pain. So I'm like, these people were all grown. Like, it's gonna hurt. But it makes me think that it was gonna like that I'm doing it wrong when you're like, you know. So I know with practice I'll get better and better. It's just that in art on the floor that I'm gonna be on, it's not like the ED. It's not all the time that we're gonna be doing it. But I learned it. It is what it is. It wasn't as bad as I thought it was gonna be, but still. I was hearing noises. I think it was my dog's nails scratching on the floor. But okay, this is the end of the video. This is my whole, hope you enjoyed it. I don't know what my next video is gonna be, to be honest with you. Just stay tuned. Bye.